If you're a healthcare worker, you probably saw the article about the nurse who put an NG tube in a patient who had a basilar skull fracture. And when they inserted the NG tube, instead of going to the stomach, it went to the brain. When they checked for placement by pushing air, the patient died. The contraindication would be we should not be putting NG tubes in any patient with facial fractures, basilar skull fractures. But there actually are a good amount of contraindications to NG tube placement. Whoa. Not just skull fractures, but patients with esophageal issues like varices, patients who have had gastric bypass surgery. And I'm not gonna lie, some of these you really don't think about. I had a patient who had an EGD done at bedside, and the GI doctor removed the NG tube and was like, this patient had gastric bypass surgery, they shouldn't even have this. So I've noted that. Also, unstable surgical spine injuries, and I'm trying to think if I'm forgetting other ones. All that to say, if you ever have an order for an NG tube and you are not sure, or you're like, I don't know if this patient should have one, does not hurt to ask. In fact, you could save a patient's life.